Healthy Living in the Four Corners is brought to you by San Juan Regional Medical Center. If you take prescription medications, would you be able to tell an emergency room physician the medicine and dosage you're taking? Dr. Robert M. Underwood, Chief Medical Officer for San Juan Regional Medical Center, is on a crusade to encourage patients to keep a list of all their medications readily available.
Having a home medication list is really important for a number of reasons. Medications should be listed as what the medication is, what your dose is, what your dosing schedule is, and actually even the route in which you take it. Some people use injectable home medications. All of those would be important for a physician who's trying to care for a patient in terms of understanding what their past medical history is, understanding whether or not there's interactions between medications that provider may be prescribing or providing, for example, in an emergency department. We also recommend keeping one in the home that's easily accessible so that if an ambulance shows up, for example, that the crew would be able to find that list so that it could be brought with you to the hospital. In addition, if a patient is taking vitamins, supplements, holistic medications, those also ought to be included on your medication list because those too can have interactions with medications that we might prescribe.
Dr. Underwood also recommends that you keep a list in your wallet or purse. The list should include the name of the drug, the dosage, how it's administered, any allergies you may have, any adverse reactions to drugs you may have had, vaccinations, and any over-the-counter medications you may take, including vitamins or herbal supplements. Having a list readily available could save your life, especially if you're in a situation where you can't respond to the attending physician.
One is we could end up with a drug-drug interaction, that's what we call it. So we prescribe one medication that may interact with another medication. That could be adverse for a patient. The other is if we prescribe or use a medication that you're allergic to and we don't know that, that could be an indication as well. I'm an emergency physician by training. When a patient shows up in the emergency department, it's confusing, it's chaotic. You may not remember everything or you may not be able to provide that history. And so that helps the emergency physician a great deal by having this list immediately available. The other is a physician will know what medications are generally used for. So if they can't get a history another way, that helps them start to build that past medical history on that patient.
To help you prepare a complete list of medications, download a home medication form from the San Juan Regional Medical Center website at sanjuanregional.com. Navigate to Be a Partner in Your Healthcare page and click on the Home Medication link. I'm Deborah Uroda for Healthy Living in the Four Corners.